Diabetes is a group of chronic diseases that lead to high sugar content in the blood by disrupting the body's use or production of insulin, a hormone produced by the pancreas, which regulates the body's blood sugar content. There are three main types of diabetes: type 1, type 2, and gestational. Type 1, also called juvenile diabetes, is caused by an autoimmune response that disrupts the body's insulin production. Type 2 diabetes occurs when the body cannot efficiently use and regulate insulin to control blood sugar levels. Gestational diabetes, which can only affect pregnant women, is thought to be caused by a shift in hormone levels during pregnancy, which disrupts the body's ability to regulate blood sugar. If blood sugar levels are unregulated, then hyperglycemia or raised blood sugar could affect an individual. Although seemingly mild, raised blood sugar levels can damage many of the body's organs and functionalities gradually, resulting in disability or even death in the long run. These complications include cardiovascular disease, depression, or nerves, eyes, and kidney damage. It is estimated that the total cost of diabetes in America is more than $327 billion, mainly due to healthcare costs and decreased productivity. The average patient affected by diabetes spends more than $16,000 a year on healthcare costs. Globally, diabetes is currently the 7th leading cause of death and has one of the fastest growing prevalence rates with no signs of slowing. The growing prevalence of diabetes could potentially create a more extensive health burden on society and decrease the lifespan of many individuals, as well as general societal productivity.
Globally, more than 85% of diabetes are type 2. According to a 2018 U.S. study, it is estimated that about 34.2 million people of all ages, or about 10.5% of the U.S. population, are afflicted with some form of diabetes. Of those affected, more than 210,000 are children or teenagers. Over 1.6 million deaths are directly due to diabetes, and another 2.2 million were due to complications from diabetes, such as cardiovascular disease, heart attack, kidney failure, and stroke. Among specific populations, the prevalence of diabetes was the highest in American Indian/Alaska Natives, both men and women, at about 14.5%. This is followed by people of Hispanic origin at 12.5%, non-Hispanic blacks at 11.7%, non-Hispanic Asians at 9.2%, and finally non-Hispanic whites at 7.2%. Risk factors for type 1 diabetes includes family history or genetics, environment, and geography. Risk factors for type 2 diabetes include weight, age, a sedentary lifestyle, high cholesterol levels, smoking, and genetics. Risk factors for gestational diabetes include age, weight, and genetics. Gestational diabetes itself can also increase the risk of The public health community has instituted numerous measures in an attempt to curb the growing prevalence of diabetes. Although facing stiff resistance from lobbyists on the state and federal level, sugar taxes have been gaining momentum in local municipalities for the past few years. These sugar taxes aim to curb sugar consumption, which is a big factor in weight gain and diabetes, and encourage manufacturers to reformulate their products to have a lower sugar content. On the national level, the USDA has made efforts to promote healthy eating with its iconic food pyramid, which outlines a balanced ratio of macronutrients that should be in a typical meal. Additionally, the Centers for Disease Control and Prevention has partnered with many private and non-governmental organizations to promote healthy eating and regular exercise in campaigns such as the National Diabetes Prevention Program, launched in 2010. This program offers easy access to evidence-based, cost-effective interventions to help prevent diabetes in communities across the United States.
About 9 out of 10 cases of diabetes can be avoided by implementing simple lifestyle choices, yet the prevalence rates for diabetes continues to trend upward across the globe. Many choose the easier path of doing nothing instead of implementing suggested healthy eating and exercise tips, since it's considered more difficult. Information about diabetes is available to the public due to the rise of the internet. Sites like the CDC and National Diabetes Association offer information about diabetes, its causes, health risks, and methods to avoid diabetes. Most importantly, an individual's primary healthcare provider can help screen for diabetes, offer practical suggestions, and help manage diabetes with effect. One of the biggest misconceptions about diabetes is that it doesn't affect individuals of a healthy weight. Although being obese increases the risk of diabetes, people with healthy weight can develop diabetes due to genetics or poor eating habits. Misconceptions like these pose a significant barrier to receiving adequate treatment. Therefore, it is essential to dispel misconceptions about diabetes. Healthcare professionals, doctors, or public health practitioners can distribute flyers or host events that help to dispel these misconceptions and allow patients to manage their diabetes effectively.